Morning. This is the May 4th, 2021 meeting of the Lane County Board of Commissioners. We actually will begin this meeting with a joint meeting of the Lane County Board of Commissioners and Board of Health. So I want to gavel that meeting in now. We will have public comments at our regular board meeting as soon as this time certain item is taken care of. So for the joint Board of Commissioner, Board of Health meeting, are there any adjustments to the agenda? Seeing none, is there any emergency business? Seeing none, we're on item 3A, report, semi-annual Board of Health report, and we have Karen Gaffney, Dr. Warren, Dr. Ledke, and Dr. Seifert to present. Please take it away. Thank you.
Okay, I have a screen to show. Hopefully you are seeing a very simple Word document. If I get a thumbs up from someone that you are indeed seeing a simple Word document, wonderful. I will begin there. So I thought it would be apropos, and Jocelyn and I discussed this as well, looking at the year that we just passed through in terms of the pandemic and taking some liberties, I suspect, maybe like click and clack and talking about the third half of our show. I thought, well, why do there have to be 4 quarters? Let's look at the 6 quarters of this pandemic. And I'm just going to review that and with a little bit of visioning at the end. Our first case became symptomatic in March 1st of 2020. And we immediately found, of course, that we had all sorts of challenges. We had shortages of our personal protective equipment. We had shortages of testing. We had a variety of infection control protocols that we not only had to put into place, but we had to share with our broader community. And probably the biggest surprise at the time was essentially due to the closure of many CBOs in our community, public health became the owner of a variety of facilities to help with persons who were houseless and also were not being serviced by some of those CBOs that were closed. A pretty heavy lift at the time. By the end of this period, we were looking towards reopening after the governor's March 23rd closure of the communities in many ways. And we had the first phase 1, phase 2 visions of what reopening would look like. And that moves us to the second quarter. We finished that first quarter with 73 cases, confirmed COVID cases. Second quarter, June through August, the summer months, we expected some cases to continue, hopefully fewer cases, and we were right about that. We were right about some things during this pandemic and certainly not right about others. We had reopening messaging to the community, the phase 1 and phase 2, as I mentioned, with looking at what phase 3 might look like, which of course we did not reach, but we had planning for that. As you recall, we had a fair amount of social unrest and marches due to a variety of national issues and some local issues too, in dealing with those marches and infection control and such. The third bullet here, I highlight a couple items I think are important to note. One of the big successes I think in this space is we really pulled together the clinical community. Early on in this pandemic, we had clinical calls 5 days a week with providers from most of the clinical space, dental, long-term care facilities, urgent care, hospitals, primary care, etc. By the end of this quarter, we had moved down to 3 times a week, Monday, Wednesday, Friday. But those calls continue, and they have really been quite successful at helping us to unify and share protocols and processes and messaging. Another big success is we really became the PPE distributor for the entire county. Our team, Pat Dodson and his team, at this point passed the 50,000th PPE article that was distributed, gowns and gloves and masks, and that even included swabs for the nasopharyngeal swabbing for testing. We shared a lot of those with our hospitals, who of course were dealing with critically ill persons and needed to have the ability to test persons who were in the ED or were coming in for elective surgeries. Big process, heavy lift for us to become the distributor of shortages of PPE for the entire county clinical complex. We finished that quarter with 715 confirmed cases, August 31st. Moving into the third quarter, we knew a surge was coming. This is a beta coronavirus. The other beta coronaviruses that circulate every year that cause the common cold in all of us, they love late fall and winter. We had no reason to think that this virus is going to be much different in that regard. We just didn't know how bad it was going to be. So we had a lot of surge preparation and response, especially working with our hospitals. We were counting ventilators one by one. Every ventilator that was in the hospital, that was in the surgical suites, that was in the ambulance transport vehicles. It was really a good time, and I think the hospitals really worked very well together, creating systems and protocols to share their resources, and we were part of that conversation as well. We also had, this is the big time of ramp up. You can see by the end of this quarter, we were up to 4,400 cases roughly. We had a big ramp up in contact tracing and case investigation and ongoing issues with supplies, continuing to try to get more and more of that PPE in our community. By the time the fourth quarter came, we were in the thick of it, largest number of cases. Every 13 days, we were getting 1,000 cases. That went on for 11 weeks straight. That was the average for that time period. Lots of case investigation, contact tracing, isolation and quarantine, lots of testing issues. And then, of course, we were preparing for vaccine arrival, which began to trickle in the middle part of December, building protocols and how we were going to work with the state and the feds on some of their criteria on who should get vaccine first. Moving into the fifth quarter, and my apologies for taking liberal aspects with our language and saying the fifth quarter, but it's kind of fun for me. This is the quarter that we're in right now, big part of vaccine administration and distribution. We are probably nearing the point in time where those persons who really, really want the vaccine are getting it. And we are going to be moving into a good deal of more branding and marketing and trying to promote vaccine much more than we already have, especially trying to reach those persons who want it and they have trouble navigating the healthcare system, and we need to reach out to them. We also have ongoing community messaging that infection control needs to continue. We still have a large number of people who are not immune to this infection, and as long as it's out there, people will get infected. And then looking forward, some visioning as promised. We will be getting vaccines approved for the adolescent age group. Hopefully in the next week or so, they will be approved, at least the Pfizer vaccine. And maybe a few weeks after that, the Moderna vaccine will be approved as well. And then late this year, we expect the child vaccines. Each of the companies appear to be doing a little bit of different age group. Some are going down to age 6 months. Several are age 5 and above. So we'll see how that shakes out. But there will be a need for plans to be put in place, especially for the child vaccines, and integrating those in the places where people are already getting their pediatric vaccines, measles and mumps, et cetera, mainly the primary care clinics. We are also in this time frame looking at the demobilization of our mass vaccination edifice, which has really been quite a building that has been put together. Hopefully, maybe by the end of June, we will be predominantly out of that business and relying more and more on those entities that already do vaccination as part of their daily business. We do expect a fall surge. Hopefully it will be no more than maybe 25%, 1/4 of the 2020 fall surge. We will have a lot of people who have immunity through their vaccinations and others who have achieved some immunity through natural infection. So hopefully we won't have anything nearly as bad as we saw last fall with 1,000 cases every 13 days, but we do expect a surge. And we are also needing to continue with surveillance in this space. We need to continue to look at variants. We're very thankful the University of Oregon does this fancy molecular testing and shares test results with us and with the state health department as well. We do need to continue looking for breakthrough infections. We believe this vaccine will provide durable immunity for some time, but none of us know how long that will be. So we will certainly have some people who are fully vaccinated who do indeed become infected further on. They will likely not be severe infections, but we need to continue to watch that. And then finally, this COVID virus is not the only virus out there. You will probably recall in 2018, we had a big whooping cough outbreak in this community, hundreds of cases, multiple schools involved. It was a real challenge. And whooping cough occurs on a timeline. Every 3 to 5 years, there's a new surge of whooping cough. We are now in that window again. And this fall and into the winter, we have the possibility of seeing whooping cough again. And the same thing with influenza, a very strange influenza year, probably the lowest number of cases of confirmed influenza in 2020, 2021 winter that this country has ever experienced. And influenza will return. No one knows how badly, but we need to continue to look at that. So that is my visioning and a little bit of the past and a little bit of the future. And I'm going to pitch it off now to Dr. Seifert.
Pat, just before we go there, let's just do a little a little setting. Chair Bernie and commissioners, thank you for having us today. We're very happy to be in front of you again. We are doing a little, for this semi-annual Board of Health report, we're doing a little bit of looking back and looking forward with the COVID response that of course has been primary in public health for the last year plus. And so we asked Dr. Lutke to give us a sense of maybe what's going to be happening a little bit going forward. I know that you're all intimately aware of the day-to-day work of the COVID response, so appreciate that. Pat has a unique gift of being able to help us visualize what's coming forward, so we appreciate that. One other thing that is very exciting for us as we begin to look forward again is picking up some of the work that we've been doing in the past that we had to pause with the COVID-19 response. And some of that very important work is the prevention work, especially when it comes to marijuana and other drug prevention among youth. I think you'll recall, and Dr. Seifert will walk us through some of this as well to reacquaint everyone with this work. But in 2019, spent a great deal of time considering the best strategies for reducing exposure to marijuana among youth and reducing actual use, because we were shown as from our prevention team that this is an increasing concern in our community. So this is our opportunity. We're certainly not past COVID, but we are starting to pick up some of the threads again of the work that had been very active before we began the COVID response and put everything else on pause. So now we can bring Dr. Seifert back with us. We're so pleased to have her here to kind of remind us of the work that had been done in 2019 and also kind of give us a sense of what our options are going forward and where those things stand. So thank you. Thank you very much, Dr. Seifert.
Awesome. Thank you so much, Jocelyn. Can everyone hear me okay?
Mm-hmm.
Yes, thank you so much. Now let me see if I can figure out technology real quick. So let me see here. Is everyone seeing my screen? Okay,
Mm-hmm.
Cool. How do I minimize this? I don't want to close out. Cool. Sorry, folks. How do I?
If it's helpful, all we're seeing is your slides, but not in a slideshow format.
Cool. So I can't see my slides. I can only see GoToMeeting.
Dr. Seifert or Dr. Warren, if you would like to email me the presentation, I can pop it up for you and run it.
Cool. Yeah, let's do that. So stop showing screen. Here we go.
So just maybe while you do that and email that to Diana Jones, I'll just take this brief moment to do a little public service announcement. After we conclude this report and are able to answer any questions that you might have related to the marijuana work, I do want to also acknowledge for the board that we take advantage of the semi-annual Board of Health to also provide you a general update about Health and Human Services. So those are in your prepared packet. We don't plan to actually present on that information today, but I'm happy to answer any questions that you might have related to the rest of the work of Health and Human Services. So we will take those questions as part of the question and answer period as well. How are we doing, Jess?
Oh, we're moving slowly. My apologies.
I was able to send it to Diana.
You were?
Mm-hmm.
Okay, I think, let me, all right.
So I bet if you want to go ahead and start, Diana can catch up with the projecting the slides.
Okay. All right, so you can hear me, yeah. All right, so thank you so much. Apologies for the rough start. Thank you so much for this opportunity to reintroduce our work in expanding Lane County's indoor clean air ordinance. I'm Dr. Jess Seifert, and I'm the substance use disorder epidemiologist with Lane County Public Health. So next slide, please. So our agenda for this presentation, I'm going to take you, provide some background into the events that precipitated this work. And then I'm going to outline the road that we've taken to expanding our local ordinance, and then update you on the current status of this ordinance and the next steps we plan to take, and then share a little bit about what issues and strategies we're thinking about beyond the Indoor Clean Air Act. Next slide, please. So some background, some context. So why are we doing what we're doing? Next. So as most of you know, the state of Oregon legalized the use, possession, and production of cannabis for adults ages 21 and over in 2014. Following legalization and with the establishment of commercial cannabis retailers, we saw a rapid growth of the commercial cannabis industry in the state as well as in Lane County. Next. So here we have the recreational and commercial cannabis retail sales in Lane County alone from October 2016, which is when retail sales, where the stores were licensed and opened for the first time in October, through December 2019. From 2016 to 2017, we saw an over 6,000% increase in sales. Obviously, that's 3 months compared to an entire year, but those are no small potatoes. From 2017 to 2018, we saw a over 25% increase in sales. And then from 2018 to 2019, we saw an over 11% increase in sales. It's important to note that Lane County is home to the second highest proportion of commercial cannabis retailers in the state, second only to Multnomah County. Next. So with legalization and the establishment of stores, we saw such tremendous and rapid growth in our commercial cannabis industry. A number of public health issues began to emerge, including concerns over youth access to and the use of commercial cannabis in the county. We know that cannabis use during youth and adolescence increases risk for the development of mood disorders such as depression and anxiety, as well as the development of addiction later in life. So the concern is really with youth using this substance during a developmentally vulnerable point in their lives, and that use having implications for their health and well-being in the future. Next, please. And so here we have the prevalence of commercial cannabis use among 11th grade students in Oregon and Lane County from 2016 to 2019. And what we see here is that use in Lane County among students increased from 20% in 2016 to nearly a quarter of students in 2019. We also see a growing gap in prevalence between Lane County and the state, with Lane County exceeding, with our prevalence here exceeding that of the state and continuing on into 2019. Next. The most recent data available also demonstrate that the prevalence of commercial cannabis use among 11th grade students in Lane County not only exceeds the prevalence in the state, so our current prevalence as of 2019 is 24.4% of students compared to 20.4% of students in Oregon, but our prevalence also exceeds that of the nation with 21.7% of students nationwide using commercial cannabis products. So with this knowledge in hand, Lane County Public Health began investigating and identifying strategies that would help prevent youth access to and use of commercial cannabis products in the county. Next, please. And so with that, the state's indoor clean air policy was identified as a potential avenue for prevention work. The evidence shows that indoor clean air laws are effective at reducing secondhand smoke exposure. They're effective at preventing initiation of tobacco use among youth. They're effective in supporting adult cessation or efforts or quit attempts, and they're also effective at reducing or preventing tobacco-related disease and death. And so with that, we look to the state's Indoor Clean Air Act. The state of Oregon passed their Indoor Clean Air Act in 1981. The expanded form of this act was passed in 2017, and this expanded form includes language regarding electronic cigarettes, electronic inhalant devices, and such. The Oregon Indoor Clean Air Act was designed to protect Oregonians from secondhand smoke exposure. This also includes aerosols and vapors by creating smoke-free public spaces and workplaces. Next, please. And so our act, as it stands, prohibits smoking or vaporizing and aerosolizing inhalants in workplaces, most public spaces, and within 10 feet of all entrances, exits, and accessibility ramps that lead to and from an entrance, exit, windows that open, and air intake vents. Next. While fairly comprehensive, the Act as it stands does have a number of exceptions that allow tobacco products to be used in certified smoke shops or cigar bars, up to 25% of hotel and motel rooms, and in theater productions where use is integral to the production. Next. To date, multiple bills have been introduced in the Oregon State Legislature that would allow public on-site cannabis consumption businesses. Now, these bills effectively work to weaken our state's Indoor Clean Air Act. Next. And so with that, to preempt these threats to our Indoor Clean Air Act locally and better protect the public and workspaces within our jurisdiction, the Oregon law grants city and county authority governing bodies the authority to create stricter local indoor clean air ordinances. And so with that, we shift our focus to our local indoor clean air ordinance and the steps that we've taken to expand that ordinance. Next, please. So this journey began March 19th, 2019, where Lane County Public Health presented a number of strategies to prevent youth access to and use of commercial cannabis products in the county. It was during this meeting presentation that the local indoor clean air ordinance was identified as an avenue that we'd like to take. Following this meeting, Lane County Public Health put together a work plan that would outline the steps for developing and implementing this local ordinance. That work plan was then presented to the board on June 30th, 2019, where it was subsequently approved. Next. Excellent. So during this, in looking at the local ordinance, the Lane County Public Health proposed several recommendations, all of which are additional language that we'd like to add to the local ordinance. This language would explicitly prohibit indoor smoking and vaping in smoke shops, cigar bars, and potential on-premise cannabis use businesses. The language would also explicitly extend the buffer zone in front of entrances and exits from 10 to 25 feet to better align with scientific consensus on secondhand smoke drift. Next. And then lastly, this language would also explicitly remove loopholes that allow smoking and vaping in theater productions, as well as in hotel rooms where staff would be at risk for second and third-hand smoke exposure. Next. All right, so with a work plan in place, excellent. So with a work plan in place, but before we were to begin drafting this revised policy, the Board of Health recommended that Lane County Public Health solicit input from community members on this proposed expansion. And so taking that direction, Lane County Public Health hosted 5 community engagement meetings across the county during from I think the end of October through November 2019. The results of those community engagement meetings were then presented to the board on January 14th, 2020. Next. Excellent. Those community engagement meetings were very helpful and very rich, and we so appreciate community members coming out and having the discussion with us. And what we learned was overall, community members were very supportive of the expansion of our local indoor clean air ordinance. In fact, many framed the expansion of the ordinance as a way to address a number of their other health concerns that they raised during those meetings. These concerns include youth substance use, the retail density, the current density of commercial cannabis retailers in the county. They also cited concerns about positive community norms regarding cannabis use, as well as the health impacts of secondhand smoke exposure. Next. Community members also expressed concerns about the health impacts sort of down the line from secondhand smoke exposure, as well as the healthcare costs. So concerned about the health impacts and the subsequent healthcare costs that are accrued from secondhand smoke exposure. They also expressed concerns about workers' exposure to secondhand smoke and their subsequent health impacts. And then lastly, community members expressed concern about the increased potential of drugged or impaired driving that would potentially occur, providing that public on-site cannabis consumption businesses were to be permitted in the county. Next. All right, so with the community engagement meeting information in hand, we received sort of the green light to begin drafting a revised policy. Next, please. So from there, we reviewed existing city and county codes regarding public on-site cannabis consumption. We coordinated with state officials to discuss the logistics of enforcing a expanded indoor clean air ordinance. And then we consulted with public health law experts and county council to discuss specific language that we would include in the local ordinance. Then in March 2020, this work was put on pause as Lane County Public Health redirected their staff and resources to begin to respond to the emerging COVID-19 epidemic. Next. And so, and now over a year later, Lane County Public Health has increased capacity and has expanded their efforts to address and respond to the COVID-19 epidemic, which has allowed many of us to return to this work. And so moving forward, we'd like, with your guidance, to begin setting a new timeline to create the revised draft and then submit it for your review. Yes, so we're nearly there, really. And so we're just picking up this work and hoping to sort of begin to move it forward. Thinking beyond the Indoor Clean Air Act, myself and our commercial cannabis coordinator, Emily Buffbear, in addition to progressing this work, we're also working on furthering other prevention strategies, such as creating and implementing cannabis inclusive DUI campaigns and completing our first ever commercial cannabis health impact assessment. We're also working to monitor and address new and emerging commercial cannabis issues that we see popping up in our community, such as high potency THC and its subsequent health impacts, such as the onset and development of psychosis, as well as really starting to dig into the impact of multiple substance use that we see in our community. Because essentially what we're seeing is if one substance is present, then another is present. And so that has pretty serious implications for the health and well-being of our community moving forward. So ultimately, we're working to promote and protect the health and well-being of our community members through this work. And that is essentially the end of my presentation. Diana, if you wouldn't mind moving just 2 slides down. I just wanted to share my contact information. It's on the last slide of this presentation. At any rate, thank you so much for this time. I do appreciate this opportunity. Again, I'm Dr. Jess Seifert, and I'm the substance use disorder epidemiologist with the county. Thank you so much.
Thank you. Is that the conclusion of the presentation?
Well, yes. I mean, there are...
From everyone. I don't know. Is this the time for board members to ask questions?
Thank you, Chair Bernie. Yes, we are happy to turn it back over to you for discussion of anything in the report, including, of course, the presentation on marijuana use.
Thank you very much. I was just looking for that cue.
Yes,
Are there any commissioners that would like to ask questions, make comments on this report? Diana, if you'd be kind enough to take the PowerPoint off so I can see people. I did see Commissioner Buck's hand.
Well, I was first pointing to Commissioner Farr because he had his hand up first, and I'll go after
I
him.
apologize. I couldn't see anything right now on this screen. Commissioner Farr, accept my apologies, please.
Thank you, Chair. I tried to pause so I wouldn't go first, but I will. Just one thing initially, and that is going back to Dr. Lutke's presentation. And Dr. Seifert, thank you very much for the update on all of your important work. We've made tremendous strides in the areas despite the pause that we've been in. It's remarkable how we really seem to be ahead of the curve, the state curve, on just about everything, including use, as it turns out, unfortunately. But back to Dr. Lutke quickly. To me, the takeaway from your presentation, many of the things that you presented were things that we knew, but the takeaway is that we have to be actively involved in what you call is branding and marketing and trying to promote the vaccine. And I see that as really being one of the things that we have to get engaged in the most, because you stated that just about every adult who has the vaccine, who wants the vaccine, has it eligible or has it available. And we're seeing a real slowdown in people accepting the vaccine. So I guess that's one thing that I don't know that we can beat it to death today, how to market it, but it really is a marketing effort to be able to, as we've talked about before, to be able to demonstrate the safety of the vaccine and significantly the importance of the vaccine to prevent what you've called, let's see, you called it, you said as long as it is out there, people will get infected. We know that, and what can we do to make certain that people are becoming immune to the virus? In particular, as we move into the phases that we're into right now, as we begin to vaccinate younger people, Dr. Lutke, I'd like to talk a little bit initially about how do we incent the younger population to step forward and receive the vaccine when it becomes available to them. And I'm not just talking about college-age kids, which we do have an issue there, and I'm not necessarily talking about 16 to 18-year-old kids. I'm talking about from 12 up. How do we provide incentives to produce a greater rate of vaccination among the younger kids? I have some ideas about that, some things to do, but really a lot of it rolls back to are their parents ready to allow their children to get vaccinations? And so how do we market to the parents? How do we brand it to the parents to allow their kids and get their kids in there for the vaccination as soon as the kids are eligible for it? And one thing I'd like to think about is, can we not take away things, but provide extra incentive for kids to get vaccination? This is a discussion that I've had with one of our great local superintendents at length over the last week, is how do we get kids to actually step into the clinics and get the vaccination? And finding ways to provide them with access to activities potentially is one way that we discussed. We're currently a school reference is that we have 2 kids misbehaving, so all kids are withheld from recess. That is an analogy that I didn't write myself, but we have a small number of people misbehaving, but everybody is being, in effect, restricted because of the small number of, I'll call it misbehaving. That's a term that I'd use. So how do we provide incentive? One thing is can we ask the state or somehow get authority to, for instance, allow preschool activities like music and like choir, the various things that happen preschool that we're currently not doing, to allow that for kids who have been fully vaccinated. I don't know that we can discuss that right now, but I want to throw that out as a possibility. As we go forward marketing the vaccine, getting people to trust it and to step forward and get the vaccination in the clinic, that seems to be one of the big areas that we need to focus on at this point in time, Dr. Lutke. And I'd love to hear what you say about that.
I'm happy to start. I bet we can tag team this, Chair Burney and Commissioners, Commissioner Farr. So there are a variety of ways to proceed with promotion of vaccine, and it can range from the financial. We have certainly done gift cards and such to persons who have chosen to be vaccinated, whether they are youth or adolescents. We've been doing that at our community health center clinics, as have other clinics in our community, for quite some time, in order to meet the state CCO metrics while also improving health. And as you noted, there are behavior opportunities as well. So providing people with the ability to attend new things if they are appropriately protected, whether that is sports or band practice or some other event. And of course, at the local public health level, we don't control some of those in the weeds type of things, whether they involve school or particular organizations, but we can look at the infection control data and foster the opportunities for those types of things to occur. And then there also is, the bandwagon effect, which is really well seen in marketing. We see that especially in the tobacco world, where in the youth group, if you can get the appropriate pictures out there, everybody's happy, everybody's smiling, they're outdoors, it's a beautiful environment. People get on the bandwagon, and marketers call that the bandwagon effect. So if you can get some inertia going, however you get that inertia going, you can promote it through this bandwagon effect. So Commissioner Farr, I absolutely agree. There are a variety of ways to proceed in that space. And I bet that Dr. Warren and Seifert, and probably Karen as well, have other ideas.
Would anyone else like to speak before I call on another commissioner to Commissioner Farr's question?
I think Pat, as always, covered it very well.
Sure, Bernie, then I just one ever so slight follow-up to something you said, provide pictures, promote people having fun outdoors in the pictures. And I think what's been evident, what's made evident to me by the people that I talk to, is that kids really value freedom of movement and freedom of access. The pictures can present that in such a way that really makes kids want to say, I would like to do that. Well, to do that, you really need to be fully vaccinated. Thank you, Dr. Lutke. Thank you, Chair Byrne.
So I would like to clarify that when Ms. Gaffney said Pat clarified that perfectly, she was not talking about Commissioner Farr. She was talking about Dr. Lutke.
I appreciate it when people do differentiate between me and other Pats that may be in the room. It happens with Pat Strawberry at Travel Lane County. It happens with Pat Walsh and Poverty Homelessness Board and Dr. Lutke here. Thank you.
Commissioner Buck, I had called on you. I see commissioners much better now. Were you next, or did I miss Commissioner Treater?
I think I'm next. So
Okay.
I'll take this opportunity, because we don't always get the opportunity to have Dr. Lutke here, even though we have another agenda item on the COVID update. Clearly, we've been seeing congregation of folks that aren't necessarily masked and following the protocols we hope and advertise out there for them. And I don't necessarily see that letting down as much as we advocate, which we've been doing for over a year. And if people don't know it by now, they've been under a rock, and it doesn't make sense. It's really just that they're not doing it for whatever reason. Either they don't feel it's important, they're scared, there's fear. I'm trying to figure out what we can possibly do to get more people vaccinated. Another concern is we have more access to vaccines now than pretty much ever. And when you don't have access, there's that pent-up demand. And so is there a demand weaning going on? What can we do to help as commissioners, other than, we advertise ourselves getting vaccine and trying to promote getting folks out there as much as possible. I'm grappling with this constant tug and pull.
Chair Bernie, Commissioner Buck. I appreciate the question. And I do think that in many ways, the cliche or that metaphor of this is a marathon, not a sprint is really apropos. As long as we have persons in our community who are not immune and the virus is circulating, we are going to have infections, period. So that is a bit frustrating to those of us who have been good residents, good citizens who have been trying to wear masks and maintain social distancing and have appropriate cleaning of high-touch surfaces and do all those things that have been shown to make a difference. They're not perfect, of course. The challenge is they don't make 100% of a difference. They make 60, 70, 80% of a difference. But that being said, there is still the opportunity to reach groups who have not yet been reached. And you have had Steve Adams, our EOC incident commander, present to you. I've been so impressed with the ability of that team to be fleet of feet and to go almost anywhere, up the river to help persons who are surviving from the fire, out to Cottage Grove, down to Creswell, out to Florence. It's really impressive. And working with all these other groups, we need to continue to do that. And then we need to work really well with these other groups that can help us identify the best places to find those persons not yet vaccinated. So we're doing pretty well with LULAC and with Centro Latino and Huerto de la Familia and the NAACP. We need to continue with each of these groups. And we also recently reached out to some of the religious organizations. We had a 2-hour meeting last week with them, and we're going to have another one coming up in about 2 weeks, trying to help find access and conversational points to evangelicals and others who may be interested in the vaccine. So I don't think there is really a special pill for this, a secret sauce for this. It just really needs to be continued looking at the horizon and continued work with our collaborators in the community. And then that branding and marketing is equally as important. And Karen can discuss whether we are, has this been presented to the board yet or not, I don't know, but we have an initiative coming up where we have been able to get hospitals and other practices to sign on to this same branding and marketing that we hope to roll out soon. Karen, maybe you want to speak briefly to that as well.
Thank you, Dr. Pat and Chair Bernie, Commissioner Buck. I think it actually plays into the same topic that Commissioner Farr first raised, which is how do we do marketing and create incentives for people to engage. And I'm particularly proud of how the community has come together since the beginning of the pandemic, and going back to Dr. Ludke's slide of really talking about how everyone has stepped in to do their piece. And so I would say this upcoming campaign is another example of that, where our healthcare community, hospitals have come together with county public health and really using some of the national research about how do we help promote that behavior change. Luckily, I think public health has been in the behavior change business long before this pandemic. So we do understand a whole lot about how do we help move people's behavior. So we do have a marketing effort that's coming up that I think it's important that it's paired with making getting vaccinations the easy choice, which is a longstanding principle for public health. So when we convince someone that yes, it's time, we need to make sure that there's easy access to be able to then get that vaccination. So as we launch more of the effort to encourage vaccination, we're also doing a more distributive approach around our access to clinics. So you'll probably see less large mass vax sites where everyone needs to come into that one location, to more distributive efforts that are more embedded in community, so that it's easy for people on their way to doing something else to make that choice. So I don't know, Pat, if you wanted to give more details, but I would say to the board that will be a co-branded effort in the community that really helps all of us measure our progress as a community in getting vaccinations and really encourage people to be part of that movement.
Thank
The only
you.
other thing I would add for, oh, sorry, Commissioner.
Oh, that's okay. I'm just looking at the clock. Go ahead, Dr. Ledke.
The only other thing I would add for Commissioner Bach is that I appreciated her comment about what else can we do. And I think that you're being present in the media and you're promoting the fact that you and your family and your colleagues have been vaccinated is really important. You are important people. And people look up to you, and I suspect there are probably days where you think maybe nobody does, but many people do. And it's really important to occupy that space. It really does make a difference. And I encourage you to do so.
Thank you. Yes, Commissioner Trieger.
Thank you, Chair. I have a couple of comments and questions on the COVID issue, and then I also have two brief things on the other aspects of this presentation, if I may. So on the COVID work, and it was perfect, Ms. Gaffney, what you presented, because it was exactly where I was going to go with this public health, population-based approach of making the healthy choice the easy choice is how we're going to do this. Obviously, in a crisis, you mobilize in a way, and it's a volume business at first with something like this, but now we're at that more sort of granular stage of how we're going to reach people and what are those population-based approaches to make that healthy choice of getting a vaccine the easy choice. Where can we locate that opportunity? And I know, it's a capacity issue for us as an organization, but it feels like I'm so excited, for example, Dr. Ledke, to hear that there's engagement with the faith community, because I think that's a place where it's the perfect intersection of gatherings of folks and trust and a sense of community and peer culture, if you will. So I think that I really appreciate Commissioner Farr bringing up schools and wonder what the role of school-based health centers might be in this moving forward for what's likely to be, in many ways, another year of COVID response, just not such an emergency response. I wonder also about, as we decommission mass vax sites, whether and what the work is with some of the larger employers and work site clinics. And then finally, whether we anticipate potentially remobilizing mass vax clinics if indeed it looks like the science tells us even those of us who were vaccinated early on in the pandemic should be receiving boost doses in the fall or winter. So that's my constellation of COVID sort of. Oh, and one more question specifically for Dr. Ledke. How are we doing for PPE supplies now? That was at the top of your presentation. That was an early challenge. How is that now?
Chair Bernie, Commissioner Trieger, I'm happy to start with the PPE, your last comment. So, we are in an adequate space. I would not say we are in a good space. By way of example, one of our hospital groups has 3 major suppliers under contract, and they still fairly regularly hear, oh no, that's on back order, you're gonna have to wait a few more months. So this country has not completely solved the PPE challenge. And I would suggest, and I hope this doesn't come to pass, but if we had a nasty fall, if some crazy variant erupted and we had a really bad fall like we did last fall, we would have challenges again with gowns and gloves and masks. Let's hope that does not happen, but there is not a local solution for that. There are local temporizing measures, sharing and such as we put into place over the last year, but it has not at all been fixed.
And Chair Bernie, Commissioner Trieger, I don't know, in terms of the vaccination planning, my gut is to hold that question for Steve Adams. I know he's prepared to really walk you through that, and you have an item with him pretty soon. So if that's okay with you, maybe we'll defer that question.
That's perfect. Thank you. Briefly to the other points in the presentation on the cannabis initiative, really appreciated the presentation. Thank you, Dr. Seifert. I wondered if you shared with us that Lane County has a higher percentage use rate relative to the state, but a little lower relative to the country overall. Where do we sit with other Oregon counties? I noticed in the materials we have one of the highest per capita rates of dispensaries, retail outlets, other than Multnomah. So is Multnomah in the sort of same boat we are? Where are we county by county in the state? Trying to figure out what might account for that higher usage rate in Lane County.
Thank you, Commissioner Traeger. I don't have specific numbers, but I do know that Lane County is looking at all of the counties together, that we are we maintain our high prevalence compared to other counties, and I think Multnomah is higher. I don't remember the specific number, and I'm happy to provide those in the future. And in my analysis, I often look at Lane County to Multnomah, but also to like Marion County, since we have a similar population density, population size. And I also look to our neighbors. So some of my work also crosses with our opioid overdose prevention work, and oftentimes we see patterns in one substance use that we might also see in other substances. And so I look to Douglas and Jackson counties as well. And I can say that, again, I'm happy to provide specifics, but from my memory, I would say that we still sort of, we're still quite high compared to other counties in the state.
Great, thank you. And then finally, for Ms. Gaffney, in the report around our youth services, I note, if I'm reading it right, you know, we have a 16-bed detention facility, and I don't see anything about COVID having reduced the number of youth we're able to house there, but the Phoenix program capacity has been cut in half. So I wonder what the difference between the two facilities or programs are that account for that, and if we know where those other 8 kids that would otherwise be in the Phoenix program are and how they're being served.
Thank you, Chair Burney. Commissioner Traeger, I appreciate you reading through the whole report and getting to the youth services, which is always at the end. And I have to say that the staff at youth services in both of our secure 24/7 programs has really done a tremendous job around COVID protocols throughout the last year. One of the big differences between the two sites, quite frankly, is the facility. And I know you've been out there and toured, and you know that on the detention side, we have a capacity to spread out much more than we do in on the other side. So that's one piece that they have done in terms of setting up separate quarantine and isolation areas away from where the other youth in detention are. Luckily, we typically do not have all 16 of those beds full. In fact, I can't remember the last time that we had that many youth in detention. That is our maximum capacity, and sometimes we get there. But on average, we have had many fewer youth in detention. And those youth who we detain are detained because of significant public safety risks. So those are youth who really we can't safely release out into the community. So we don't have a lot of choice, I guess is what I'm saying on the detention side, other than to make sure we're really attentive to infection control protocols so that we don't have outbreaks in detention. And it's been interesting on the Phoenix side, the youth treatment side, at the beginning of the pandemic, I think when there was so much that we didn't know about COVID, we had a pretty strict response to make sure, quite frankly, that we didn't expose young people and get them sick inside our facility. And then as we learned more into the fall, we actually opened up more of Phoenix, and we've been able to bring more youth in. And it's exactly in recognition for what you just said, which is that those youth really need treatment, and there aren't a lot of resources in the community for that. So during the time when we weren't able to accommodate youth in the Phoenix facility, our staff did a really good job of checking in with kids at home and trying to keep that connection up before we felt like we could safely bring youth back into the facility. And since we have brought youth back, we're conscientious about cohorting, making sure that if we do have an outbreak or an incidence of infection, that we're able to detect that quickly and that we have limited exposure on that. So we've actually been opening up more and more in Phoenix, doing that same risk-benefit analysis that I think we've done throughout the pandemic in the community, and determining that really there's a serious public health impact for those youth not getting treatment as well.
Thank you very much. Appreciate that.
Okay. First, I would just like to comment that if I were to take, this is the semi-annual Board of Health report. If I were to take the minutes spent on topics, I would say that the Lane County Public Health is more interested in marijuana use amongst young people than it is as it relates to COVID and where this epidemic is going, just in terms of time spent. And that doesn't deal with all of the other areas of public health. So I'm going to limit my questions to what was presented, although I know there's a tremendous amount of other things. One, I find it very interesting that, first, Dr. Ludke, do we have a copy of the PowerPoint you presented while you were talking? Because I had a very difficult time reading it, and I thought that was a useful framework. I didn't see it in our materials. Did I miss that?
I sent it to Diana. I suspect she can get it to you.
Okay.
I will ask her to do so. Thank you.
And maybe she already has. She's listening. Thank you very much. When I was in college a mere 45 years ago, there was a movie called Reefer Madness. And Reefer Madness basically talked about marijuana being terribly illegal and being the gateway to every kind of mortal sin known to humanity. I now have heard Dr. Siebert, I believe I've heard, or Siebert, you say that we know that where there's marijuana use, there are other drugs prevalent. And I'm wondering, was Reefer Madness correct? Or have we moved our analysis a little in terms of why marijuana is such a problem now that it's being legalized so much? Can you help me with that? Is it a gateway drug? Is that what we're concerned about?
Thank you, Chair Bernie. I would say that we're not necessarily concerned about cannabis being a gateway drug. So we know that substance use generally is generally associated with mental health, at a particular time, and we know that youth are the adolescent period is a time of experimentation where youth are trying new things, and some of those new things are substances. And so I wouldn't say that our concern is necessarily that cannabis is a gateway drug, but that the use of cannabis during this developmentally vulnerable time in youth's life as human beings and in their development has long-term adverse health implications for their future. And so we are talking about cannabis specifically in this presentation, but it's important to note that in Lane County, substances are often used concurrently, or if an individual uses cannabis, they might also use alcohol, or they might also use cocaine or some other drug. And so it's really
correct.
I'm sorry?
All of which are now legal in Oregon. Is that correct?
That, yes. To a point, yes. And so it's not necessarily the legalization piece, but ensuring that we're providing youth and adolescents the opportunity to fully develop as healthy adults, and giving them that opportunity to do that. And so with legalization, we do see that there's increased access, there's increased availability, and some of our sort of education and health promotion pieces is connecting with the adults that are around youth and saying, let's talk about safe storage of your cannabis. Cannabis is legal, alcohol is legal. Let's just make sure that we're storing it safely and we're using it responsibly so that our youth and adolescents aren't accessing it because their use during their youth and adolescence does have serious and long-term implications for their health and well-being down the road.
No, I appreciate that, and I don't want to put you on the spot. I mean that. I would like to say whether we're talking about gun use or opioid use or the use of whatever. I'm guessing that friends of mine when I was in high school used beer in much the same way. I'm not going to suggest that I remember waiting outside of 7-Elevens and finding some adult that might buy a 6-pack, but my guess is it occurred now and then. So that's why I'm curious about this focus on cannabis, especially when through the way we have responded to COVID in this society, we have left these young people dangling, disengaged, not knowing what's happening, et cetera. So I'm not taking argument with anything presented, but I am questioning, you know, why we're using this versus another vehicle to get at some of these issues. And I'd like to make a couple other points, if I may, and forgive me, time's running, and anyone can respond when I'm done. But Karen, 8 months ago, I checked, we talked about branding and marketing campaign as it related to proper behavior to avoid spread of COVID. Maybe there have been a tremendous amount of ads. You said you were contracting with media companies, if I recall. I have not seen those ads, but that doesn't mean they're not out there. But they haven't touched me in my daily life. And now I'm hearing about this new initiative with hospitals. So, I mean, maybe at the next meeting, you could tell us what you've done and how many touches you've made and whether, in fact, that's occurred, because, you know, this is not a new subject, and yet I'm hearing there's this new initiative. And I know I'm catching you off guard, but maybe down the road, you could discuss that with us, because this is how we're going to get through this. To my understanding, is vaccinations and in fact responsible behavior, and they go hand in hand. And we're at a point now where if we don't have that massive, my opinion, professionally managed marketing and outreach and touches and assessment of how many touches change behavior, all of that, then I don't know what we're doing in that one little regard. Do you want to respond to that before I move on to another point? Because I'm not meaning, yeah.
No, thank you, Chair Bernie. And I will be brief here because I don't have the data with me, and so I'll follow up with data. We absolutely have been doing both paid and earned media campaigns for months. And so we can get you the data on touches. And I'll have to ask Jason why he wasn't targeting your particular demographic if you haven't seen those. Because I know they have been coming across my television and social media, but I will get you that.
Listen, I'm delighted to hear that, because I'm not, representative. So thank you very much. And finally, Dr. Seifert, if I may, you mentioned your community engagement meetings, and that seemed to be significant in terms of justifying moving forward. So may I ask, how many people were involved in those meetings?
I actually don't remember off the top of my head, but I can get those numbers for you.
10, 100, 1,000?
Not 1,000. Yeah, so I will say that we definitely recruited through our community partners in order to get participants for our community engagement meetings. I think that there were, maybe 5 to a dozen at each meeting, but I cannot remember off the top of my head. It feels so long ago, but I'm happy to get those specific numbers for you in the future.
No, that would be fine, but you said each meeting, how many meetings were there?
There were 5.
Okay.
Yeah.
Yeah, I would be curious what the questions and the format were to generate that. Anyway, that's all I have. I really appreciate the report. Did I prompt any other commissioners that would like any other ask any questions, or any staff that would like to say, Chair, you don't know what you're talking about? I see Commissioner Farr's hand up.
Thank you, Commissioner Bernie and Chair Bernie. I'd like to remind Ms. Gaffney that you and I, beyond our community outreach meeting, Senator Wyden had a pretty strong meeting involving virtually all the local high schools that were represented regarding tobacco use. And Ms. Gaffney, you and I were at that meeting. Very strong involvement, not just in our community meetings, but in many different venues. So we got a lot of input beyond just our own. The second is that I would like to point out that this headline, if you can see it, that's not coming up very clear. Bethel schools. It says Bethel students boost local COVID-19 vaccination efforts. I just want to pass along a thank you and cheers to our health department that worked closely with Bethel schools to open an independent vaccination clinic at Willamette High School, which is reaching very deep into the student population because of the trust that they have in the people and the faces that they see there. Other school districts are either contracting or opting not to vaccinate on sites. And Bethel is doing what I believe to be a really superb job of getting deep into the student population. And thanks to Chris Parra, and Chris pointed out both Micah Brown and Steve Adams, and in particular, Steve Moker-Heisky, in opening the door to make sure that that happened through our health department. So thank you all for doing that. It was pretty amazing. Thank you, Chair.
Thank you, Commissioner. And Commissioner Trieger.
Thank you, Chair. Being mindful of the time, I just wanted to respond. I think really for me, what your comments, Chair Berney, bring up is when we have only semi-annual reports from our Board of, as the Board of Health, from our Public Health Division, when the Public Health Division, you know, the packet being 15 pages long and outlines all the many, many, many ways that they're working to serve and impact community. Really, I think the reason, if I'm understanding, that the cannabis work was highlighted rather than is being prioritized or talked about as if it's the most or the largest body of work of the division is a timing issue. And I also just can't help but point out two important distinctions. One, you referenced being in college. This is talking about use amongst 11th graders. There's a big difference in those few years in terms of judgment and development and so on. And the other is the nature of the product and its availability since the time when you and I may have been in our teens and 20s versus now. And as a grandparent of two 15-year-olds, one, yay for Pfizer maybe being able to get them vaccinated, but on the cannabis issue, the explosion of availability of the product is of great concern to me, and the commercialization of it, much the way we saw with tobacco, of using flavored products and candies and attractive color. I mean, it's a completely different market. It's a completely different product, and it really is a true public health concern and quite different. And I am more than happy to have more conversations offline with you, Chair Berney, on this topic. And if anything, I would be happy to have more frequent than semi-annual reports, just because the work is so rich, so deep, and so impactful of the public health overall. So thank you.
Thank you. Are there any other commissioners? Karen, you're not a commissioner, but the floor is yours.
Thank you, Chair Berney. No, I'm very clear I am not. I wanted to just add to Commissioner Trieger's answer in terms of why we lifted up this particular item. And we did slip some COVID in there with Dr. Ledke as well, because we know how important that is. But the work around cannabis, as it's framed here, is policy work, and that is the work of the Board of Health and the Board of Commissioners. So from our perspective, as we're able to begin taking back some of that work that was pre-pandemic work, it was important to us as staff that we reconnect with the board on the conversation we were having with you about what is the best policy response to really the exponential growth we've seen in cannabis in the community since the law changed. And so that's why we chose to take the time today to focus our presentation on that particular item, and we're happy to come back as often as the board would like to hear from us.
Thank you very much. I'd like to say something first, if I may, Dr. Seifert, and that is that actually, Commissioner Tree, we don't need to have, I agree with everything you said. My pointed remarks, just for clarification, are dealing with some of the, I agree with everything you said, dealing with some of the hypocrisies in what's making money and commercialization and corporate control of these kinds of things that are touching our children, and advertising and creating an environment where we're having to look at the kinds of policy frameworks and things in responding to things that are stronger than we are, and yet we are the elected officials representing the community. So I appreciate all this conversation. It lets me clarify, and I think we're all on the same page. And Dr. Seifert, I'm sorry, I just wanted to make that clarification. I know you wanted to say something.
Thank you. Thank you so much. I appreciate your comments and your questions, Chair Bernie, as well as your thoughtful insights, Commissioner Traeger and Karen. And I also would just like to take a quick moment to highlight that the intersection of COVID and substance use. So I've been I've been managing COVID outbreak investigations for quite some time now, but I've been able to start shifting back into substance use work. And I'd really like to highlight that we're going to see, we know that alcohol use has drastically increased during COVID. We know that cannabis use has drastically increased during COVID. And we know that people in Lane County are experiencing some pretty considerable mental health issues. I think we saw that there was a survey that said 50% of our community members were experiencing some sort of adverse mental health issue, and cannabis and alcohol are both depressants, which don't help, right? We use them as coping mechanisms, but so I just want to take this moment to say thank you for participating in this discussion and just sort of raise your little antennas a little bit on the upcoming years, because we're going to see the implications of that use and that intersection of, and we currently are seeing that. We're seeing that now, and we will continue to see that. And so I just wanted to raise that awareness, and thank you so much for your contributions to the conversation.
Thank you. I was remiss in saying that Commissioner Bozovich is absent and excused. I know he would have wanted to be part of this, and it was no disrespect at all to this body or this topic. And I also like to say to our public health people here that, you know, the 5 commissioners represent a bunch of school districts, and many people are running for election to boards of education now in those school districts. And if there's, you know, getting back to Commissioner Buck's point and to Dr. Ludke's point, if there's any messaging, specific messaging to candidates and to school board members that exist now, as it relates to what you'd like us to get attuned to, what you'd like us to promote in turn as these vaccinations now are moving to younger age children, please let us know. Commissioners, with your permission, this then ends our joint meeting of the Board of County Commissioners and the Board of Public Health. Dr. Ludke, Ms. Gaffney, Dr. Warren, Dr. Seifert, thank you so much for your time.
Thank you so much.
Okay, we are now adjourning that meeting of the Board of Commissioners and the Board of Health, and we are opening up the May 4th, 2021 Board of County Commissioners meeting. Again, Commissioner Bozovich is absent and excused. Number 1, are there any adjustments to the agenda? Seeing none, is there any emergency business? Seeing none, we are now at the public comment portion of our meeting. And hold on a second. So at this point, with this virtual format, and to the public watching, you are currently registered in this meeting system as attendees. Attendees are webinar participants. You are audience members viewing the meeting. Your microphone and your webcam are automatically muted as attendees. At this time, during public testimony, if you wish to make public comment, please raise your virtual hand to be recognized. You should see a hand icon on the device you are using to watch the meeting. Press once to raise your hand. Diana, for those of you who are raising hands, will then be our moderator, She will call names. When your name is called, you will be unmuted and given up to 3 minutes to make your public comments. When that time is up, you will return to muted status. The next name will be called, and you can continue watching this webinar as long as you choose. The intent is for everyone to be able to speak that would like to. Diana, at this time, are there people that would like to address the board?
Chair Bernie, I do see we have some people registered as attendees. If you would like to give public comment, please raise your virtual hand now and I will call upon you. I do see one hand raised, and that is Kathy Holston. Kathy, I will unmute your microphone and you may begin your public comment. This is odd. Hold on one moment. Okay. Doesn't want to. There we go.
Okay.
You can begin your public
There we
comment.
go. I think you can hear me now. I saw someone's face smile. Hi, Joe. Thank you, Chair Bernie, and thank you, commissioners, who allow us this opportunity. So I'm speaking today, make it clear, as the mayor of Oak Ridge. Commissioners, by unanimous vote and in response to the strong feelings of our citizens, the Oak Ridge City Council voted to formally oppose the proposed land use changes requested at the old Hazeldale Quarry. The City Council has an ethical and a legal responsibility to ensure that our citizens receive an adequate supply of safe drinking water, free from contaminants, clean air, acceptable noise levels, suitable livability, and safety on our roads. We believe that we have a community to protect. Allowing a mining quarry on the very edge of our city limits will negatively impact Oak Ridge. We value the lifestyle afforded us by our location within the Willamette National Forest. We have capitalized on that and become the mountain biking capital of the Northwest, a brand created and promoted by Lane County Tourism. Lane County has committed thousands of dollars on behalf of Oak Ridge to market tourism and assist established as well as new businesses with marketing in a tourism-based economy. Research shows that the quarry and mining operations create multiple health hazards despite regulatory efforts. Oak Ridge residents are already struggling with barriers relating to poverty, access to medical care, and chronic disease. Further compromising our air and water quality would only increase health risks in our community. You are aware that the EPA awarded Oak Ridge a $4.9 million targeted airshed grant. The purpose of this, as stated by the EPA, is, quote, to reduce air pollution in the nation's areas with the highest levels of ozone and PM 2.5 ambient air concentrations. Oak Ridge more than qualified for this grant. The quarry adjacent to the community threatens our air quality. This is a blasting quarry, and the dust pollution, despite mitigation efforts, will not prevent particulates in our air. Not just once, but on an ongoing basis. We will be subjected to the dust and particulates from an operation and transportation through our community. Our partners in this effort to improve our air quality have been numerous. Lane Electric Co-op, Oregon Regional Solutions, Homes for Good, Oregon Housing and Community Services, St. Vincent de Paul, Lane County Public Health, Orchid Health, Lane County Economic Development, Forest Service, Oregon Department of Environmental Quality, and many, many more. Consider carefully all that the federal government and Lane County and these many partners have invested into Oak Ridge, economically and environmentally. And with one vote, you will now be choosing to either reverse or protect all of these efforts. Lane County is focused on green solutions to solve our challenges. It makes no sense to approve this land use change, giving the go-ahead to a quarry that will pollute our air, contaminate our rivers with runoff, impact our aquifer, and threaten our wildlife inventory. Now, while I understand that you are being directed—
Kathy, if you can wrap up, your timer has expired.
Yep, I'm done. While we understand that you are being directed to decide on the remanded points, we are urging you, our elected officials, to courageously make a statement and stand with the citizens of our community and our county. The city of Oak Ridge unanimously opposes the land use change at the old Hazeldale Quarry. Thank you very much.
Thank you, Kathy. At this time, I do not show any other hands raised for public comment. If you would like to give public comment at this time, please raise your virtual hand and I will call upon you. Chair Bernie, I do not see any additional hands being raised, so I will return the meeting over to you.
Thank you very much. Are there any commissioner remonstrances at this point? Commissioner Buck.
Thank you, Chair. I just want to be clear that we will be talking about this later, and what Mayor Holston has stated hopefully will go into public testimony during the hearing in the afternoon. If that's in writing or verbally as the public comment, I just want to make sure that we are able to capture that for actual public testimony this afternoon. Thank you.
Thank you, Commissioner. Anyone else? Okay. Mayor Holston, you know very well we've worked together, and I hear you loud and clear, and I think that's a very significant statement that the city unanimously has taken the position it has. And thank you for taking your time to share with us. And as you know, we will be dealing with this afternoon. Thank you very much. Seeing and hearing no other commissioner that would like to make a remonstrance at this time. Last opportunity? Okay. We are now moving to item 5A, County Administration, COVID-19 Response and Recovery. Mr. Mokrahysky and Mr. Adams, if you would.
Thank you, Chair. And I think I'll turn it over to Mr. Adams to provide you the update. We imagine there may be some discussion and comments from the board, so we want to leave plenty of time for all of you to have your discussion. So Steve, go ahead and take it away.
Steve, thank you. Chair Bernie, commissioners, good morning. I'm delighted to be with you this Tuesday morning. Pulling up my slides here as I speak. All right. So I begin this morning with the epi curve. I have returned now to the long view. For the last few briefings, you'll recall that I've showed you kind of a tighter view, but I wanted to put this in context and to see the kind of slope of the curve that we're seeing at the moment. It is to the right-hand side, and it is not insignificant in the grand scheme of the pandemic thus far. Now zeroing in on that portion of the larger curve to show you specifically the last 30 days, you see the evidence of our trough in early March and the long march up and the more rapid rise that we have seen in the in Lake County with respect to cases. And so with this morning's numbers, 12,574 cases since the beginning, and the data on the slide in front of you is yesterday's data. That's an increase of 47 over the last 24 hours. We have seen an increase in hospitalizations in the last 24 hours. We had 6 admits, bringing Lane County residents in hospital to 19. Also an admit to ICU. So 6 of the 19 now are in ICU units. We're tracking, of course, the Oregon hospital numbers, and in the last 24 hours, we saw a decline of 10, bringing that number to 343. As of this morning's numbers, we were advised that there were no new deaths, that we were holding firm of at 144, but I was alerted during the Board of Health meeting that we just had a reported death from an individual that has been in hospital now for over 2 weeks. So that's the first death since April 6th was our last reported death. So we are seeing evidence of community spread throughout the county, and that is showing up, I think, in our risk numbers. So our most recent risk data now, and you'll recall that we are now on a weekly rather than a bi-weekly risk assessment from state government. And for our most recent week ending the 1st of May, we had 230.4 cases per 100,000. So that is an increase from 214, where we were 1 week ago. And that triggered, of course, the movement into extreme risk in conjunction with the hospital, the statewide hospital metrics being triggered as well. So we continue to see an increase here locally. Oregon statewide has moved from 239 to 265 in that period of time. I'll also call your attention to the test positivity data as well, as those are trending upward through this particular surge that we are seeing. One of the, we've been looking at these data specifically, and this is a very, very busy slide, but what this chart attempts to do is to break out 3 different periods of time. So in each of the 4 boxes that are presented by gender, by race, by age, and by ethnicity, you see 3 specific individual measures. The first set of measures is looking at what Dr. Ludke described as the first couple of 3 quarters of the pandemic experience thus far, the time from onset of cases through the beginning of the surge that we saw in the fall. The middle set of indicators shows the distribution from October 2020 through January of 2021, which really is kind of the time of the surge. And then on the right-hand side of each of these 4 panels, you're seeing the current surge, which we date to right around the 1st of April up into the current time. I would call your attention to the panel on the upper right-hand side, cases by age group. I think one of the most significant aspects of this particular graphic is really seeing the difference that vaccination is having in our community. If you compare the Surge 1, October 2020 through January 2021 to Surge 2, April 2021 to current, you see a difference in the older age categories in terms of the percentage represented in our case counts. And that is evident all the way up to the 50-somethings in this particular graphic. Also notable is the younger proportionality. So those individuals really from 10 to 29, as I have indicated in previous briefings for this board, really are showing now a proportion of a greater proportion of the cases that we are seeing within the community. And I think one of the major takeaways here is that vaccination efforts work, where we have very significant penetration into the population of Lane County for vaccination efforts, and we see that most notably in our older demographics because of the sequencing guidance that we've been operating under since January. You see reductions in the percentage of cases that are represented in those particular demographics. So obviously our extreme risk, and as of the data that I just presented that was released this morning, we will remain in extreme risk for the next period, meaning this coming Friday through the subsequent Friday. And our risk level for the week out will be a function of the numbers that are released next Tuesday. But the local numbers, obviously we need to get below 200 cases per 100,000 in our particular local metrics, and the statewide numbers are worthy of tracking as well. So you see an increase week on week, with 351 being the daily, the current period daily peak over the past week, and an increase of 18.2%, which exceeds the 15% metric that the governor outlined, and we anticipate this to be the case for some time. So we then begin to think about hospital capacity. And I really appreciate Commissioner Buck posing the question last week during the regular board briefing, and very specifically, the Commissioner Buck inquired about the number of beds available in Wayne County. That the answer I was unable to provide at that time is 453 staffed beds and 64 adult ICU beds in Wayne County are currently there. So we currently, as I look at the data, we have, when you add the 19 Wayne County individuals together with those that are not Wayne County residents, we currently have 22 individuals in hospital. We are in Region 3, obviously, as you see on the map. 22 individuals in hospital, 8 individuals in the ICU. That are COVID cases, and you couple that with the metrics here of other individuals who are in both ICU beds and non-ICU beds, and you see kind of the capacity considerations that I think perhaps animated the governor's decision making over the past 2 weeks. So I think the story here is obviously the current case surge that we're seeing is one in which we are seeing community spread. And that is most evident, I think, right now in our cases. So since April 1, we've had 1,755 cases of confirmed in Wayne County. And over obviously that same period of time, we've been working hard to expedite the vaccination efforts. I put these numbers before you. This is the April 26th benchmark where we were last Tuesday, in which 166,544 individuals had received at least one dose of vaccine in Wayne County. And then compare that to where we are today. We're at 179,881 people in Wayne County having received at least one dose. That is essentially 47.5% of our entire population in Wayne County. And that compares favorably to the same metric statewide, which is 42.9% across Oregon. And as well as nationally. So across the United States, 44.6% of our population, our full population, has received one dose. So we have 33.6% of our entire population having received, completed the series, both doses of either Moderna or Pfizer or the single dose of Johnson & Johnson. And so that compares nationally to 31.5%. So when you take the age eligible component and put that forward, we have gotten 57% of our adult population into vaccination. So this effort has to continue. There was quite a bit of discussion during the Board of Health meeting this morning about the nature of the vaccination efforts, some of the news that we're seeing nationally, some of the news that we're hearing from around the state, and the efforts and shifts in our strategy that will have to result from that effort. I know we have heard and have had many conversations with many folks around the county. Certainly, I know that the business community and others are not particularly pleased with our extreme risk characterization at the moment. And I'm hearing that frustration, and certainly with some of the reporting of weekend gatherings, that really is an issue that really, I think, drives some of those sentiments. And others, I think, are in essence, displeased to see those kinds of activities as well, just from a community spread perspective. And so we certainly share that. We are not yet at the moment when we can begin our efforts to get back into public life, to rejoin our families, though that moment is coming. And in large measure, we need very specifically to get another significant increment of our population moving forward. Dr. Ludke indicated that there is a risk of a surge in cases, perhaps 25% of what we saw last fall occurring this coming fall. And the relative size of that surge will really be driven in large measure by the percentage of our population that we're successful in vaccinating this summer. So with that, Chair Berney, I suspect the board has many questions this morning, and I will conclude my remarks and reserve time to do my best to attempt to answer those questions.
Thank you very much, Steve. And before you could even say that, I saw one commissioner with her hand up. So we will begin. Commissioner Buck.
Thank you, Chair. In the slides, you had mentioned Surge 1 and Surge 2. For me, that's a bit confusing because I've been hearing we're in the 4th surge. Can you tell me what the difference is there?
Chair Berney, Commissioner Buck, it's a great question. I think that really, I think in Wayne County, we've seen 2 surges, though we've seen 4 surges nationally. We saw a surge nationally, you'll recall last spring, largely centered on New York. Over the summer months, it was more in the Sunbelt states that we saw a surge. We really locally took part in the winter fall surge that really hit many places around the country. And now we're, I think, kind of bringing up the rear, as it were, for the 4th surge, which really began in the upper Midwest, peaked relatively quickly, and now has tailed off in some of those regions, particularly Michigan, Wisconsin, Minnesota, and now it is hitting the Pacific Northwest particularly hard.
I appreciate that clarification because at first that was the first thing I was wondering. On the other item, when it comes to hospital capacity, I appreciate you getting back to us on that because or at least my concern was if we're having hospital surges in the Portland metro area, when would we be notified if they needed to transport patients, which I know that we would gladly do? How has that rolled out, if at all, for us locally?
So, Chair Berney, Commissioner Buck, the process, as I understand it, is within each of these regions are coordinating councils amongst hospital officials and local public health officials to discuss, first and foremost, capacity locally. So the preference would be to move patients from one location to another within a region if that's needed, and only once the region as a whole reached some level of saturation would then we look specifically at transport south in our case. So it is that region 1 and 6 that is most taxed at the moment, the Portland metro region, the Eugene Springfield area being the 2nd largest area for area of capacity available should that happen. That process would go from that region through OHA to us in engaging with our partners here locally to make plans and preparations. We have adequate capacity at the moment. We continue to look pretty good, even when you account for the non-Wayne County residents that are currently in hospital right now. We have 22 COVID patients in total, 8 of whom are in ICU beds. Currently, only 2 of whom are on ventilators. So our ventilator capacity remains quite good as well. In fact, we have 55 ventilators not in use currently.
Thank you, Commissioner. Was there anything else, Commissioner Buck? No? Are there any other commissioners that would like to address a question? Commissioner Trieger.
Thank you, Chair. Good morning, Mr. Adams. Thank you, as always, for the updated information. Is there a sense, I mean, we've been hearing we're doing a great job with our vaccination program. Is there a sense of what that tipping point is? Of course, we want everyone eligible to be vaccinated, everyone who is medically eligible to be vaccinated. But do we have a sense of what is a sort of tipping point of the percentage of the population that needs to be vaccinated to really create that shift and counteract case spread?
Chair Bernie, Commissioner Trigger, this is, I think, the million-dollar question amongst a lot of folks in public health. Certainly, folk are suggesting nationally, I'm reading voraciously everything I can get my hands on. I've seen herd immunity numbers in the mid 70s to mid 80s in terms of total vaccination rates. There's national demographics versus statewide demographics versus county demographics will differ. And so we already see evidence that there is differences state by state, county by county, and region by region is in terms of vaccination uptake. I think that there is some sense that you begin to see some evidence of the vaccination effect really starting to kick in somewhere in the 50 to 60% range. There's evidence coming out of California now with respect to kind of the slowdown in cases that they've seen in recent weeks, particularly in some of the metro areas where you have much higher vaccination rates. The city of San Francisco, for instance, has a very high vaccination rate. And you have seen that beginning to show up. I think it's a matter of some speculation. My hope was that we would crest into the lower 60s here in Wayne County for a vaccination rate before we began to dismantle our mass vax efforts. I really wanted to use that apparatus as a means to very rapidly deliver vaccine and to set us up for kind of the longer haul effort that Dr. Ledke and others discussed during the Board of Health session this morning, which we know will be a long-term effort. And so we've deployed a mass vax strategy. We've deployed a kind of targeted, tailored solution strategy in which we're doing clinics in concert with community partners. And then we've been steadily feeding doses into pharmacies and primary care providers, knowing that as we shift out of mass vax, those other strategies will have to carry much more water in terms of getting us closer to whatever that number might be.
Great, thank you. And I look forward in future weeks to hearing more about those longer haul efforts that are more sort of community-wide approaches. And you and I have had this conversation in terms of the risk categories and so on, that it's always that balance between having increased compliance with maybe a decreased rigor of protective measures and where that sits. So that's the challenge. And I can't help, given the international news about what's happening in India, but be sure that we remind ourselves to zoom out, that while we are appropriately focused here on Lane County, specifically in Oregon more generally, this is a global pandemic. And the more other states and countries start to improve their rates and travel opens up, a virus doesn't care about nationality or about borders. And so it really is still a real urgent and emergent crisis globally. And that will start to impact us as air travel and other means of travel and commerce internationally opens up. So I just wanted to also zoom out and give that context and perspective. And before I conclude, I just want to send my condolences out to the family. That's very sobering news that we've had a death. It's good news that it's been so long since we've had that report, but very much appreciate you bringing us that information. And I'm very sorry to the family and folks that are connected to the person that was lost to this terrible disease. Thank you.
Thank you, Commissioner. Yes, Commissioner Farr.
Thank you, Chair Bernie. Steve Adams, I want to personally thank you for the work that you're doing, the tireless work. I've witnessed it personally, and I'm really amazed by what you're able to generate in terms of results. I will reiterate some of the things I said, a couple of things I said in the meeting this morning. The first is that I've been meeting pretty regularly with Chris Parra, Dr. Chris Parra, a great superintendent of schools from District 52, Bethel. And she raised your name in particular in praise for opening doors. You and Micah Brown, in conjunction with Ms. Smoker High School, opening doors to help the Bethel vaccination clinic, High School open. reaching deeply into the student population in ways that it's more difficult to do with mass vaccinations. They are personally addressing the issues. Thank you from Chris Parra for that. I'd like to state beyond that, we're up against some pretty formidable competition in terms of our efforts to get people vaccinated and to understand the continuing escalation of the spread of the virus. And I'm going to give a couple of quotes here. First, I'm going to say that last night I was watching The Voice, a TV show that on NBC. There's a couple of commercials that were put on by Hollywood, our competition in our efforts. And Hollywood, it was a commercial for going back to the movies, saying basically, now that it's all over, let's get back together at the movies. And they have wonderful clips of movies and stars saying, yes, yes, we're back in it. This is what we're up against. I think they have a few more dollars than we have to propagate their message. And so it's difficult for us to get salience or to get a foothold with messaging. We're up against that. We're also up against social media. I got a quote from social media. They finally are asking for the data and science that Brown is using to make the decisions. And they know that she reduced the number of dedicated COVID hospital beds to make the percentages of availability look bad. A lot of people responded to that. It feels to me that the lie is unraveling and those who told them are holding their tongue, and people start to see all of this for what it is, and people are rising up, speaking out, and resisting. Well, this morning in the newspaper, we had a picture right on the front page of the Register Guard of what I estimate to be 200 or more kids, shoulder to shoulder, kids, young people, shoulder to shoulder, unmasked, celebrating, and in some ways flaunting the fact that there was a mass gathering. We've talked about this. This is what we're up against, Steve. We have people who think it's over. There are people who think it was never there. And there are people who think that even if it's not over, I don't care. And I don't know what we can say about it at this meeting, but we're all strongly and acutely aware of the fact that we have got to propagate the message that vaccinations are a good thing, that we're vaccinated and that they can trust it and that they can trust it for their kids, and that we need to make sure that people understand that the vaccine is not going away, nor is it going to go away, particularly in light of the fact that it's being flaunted. See, say whatever you wish to say about that, but really it is a formidable opposition that we are up against.
Chair Bernie, Commissioner Farr, I could not have said it better. You're very eloquent in stating both the challenges that we're up against. And I think, not only for, commerce, certainly there's been significant economic impact across the country, and many industries are ready to get back up and running. Individuals of whatever age are very keen to begin to reconnect once again. And we're seeing that in the case data. I have spent the last several days just pouring through the case investigations of the 1,755 cases that have been reported here in Wayne County over the last, since April 1, and really trying to make sense of what I'm seeing. Doing a statistical analysis on that quantity of highly qualitative information is very difficult. But what I see over and over and over again is evidence of household spread of, essentially you could put a goodly number of that into buckets of weariness with the pandemic and all that it has cost us from the perspective of being with our loved ones, our friends, having fun, going to the movies. I so cannot wait myself to go to the movies with my family, something that we enjoyed. I feel acutely the sentiment around the party over the weekend. And it is, I'm not sure what level of messaging will be successful in trying to beat back not only the volume, but just the wealth that is put behind some of the messaging that we're up against. If I could do anything, if I had a magic wand for just a moment, it would be to push all of that anger, all of that anxiety, and all of that energy into vaccination efforts. If you are a business owner, talk to your employees. If they don't have had an opportunity to have a vaccine, give them some time off so they can go. Get them there. It's in your own financial best interest to get them vaccinated. If you have friends that you want to circle with, you want to get back together with, look at the CDC guidance and then ask the question, are you vaccinated? Why not? I am. So if we can really push so much of this forward, I look at the events over the weekend, and it's easy to say, you should step up, you should do more. Your students are partying off campus. And I hold that up to the fact that over the last 2 weeks, UO, at their own effort, has administered 4,780 vaccinations. I think that's really where we have to put the energy. Trying to tamp down college parties, I think, is always going to be a losing affair. Really and truly, you're fighting hormones, you're fighting, human development at the end of the day. But vaccination is how we get out of this, and we get ourselves into a position where we don't have to worry about, ever being at risk for massive shutdown of our economy again.
Steve Adams, thank you very much. And Chair Bernie, one thing I'd like to restate that Steve just said, and that is, first off, I was going to ask you if I have a right to be angry that kids that we're having these I keep saying kids, the young people are congregating, that anybody's congregating. Do I have a right to be angry? What you've said, push your anger and frustration into vaccination efforts. Thank you for that. And that is what I will do.
Please, Commissioner Trieger, go right ahead. This is an important subject. Yeah.
Thank you. I just wanted to offer a very brief example. Earlier when Commissioner Buck asked, what can we do? And I think often as commissioners, we think, what can we do that's very public, that's policy driven? But I'm just going to give a very simple example of something that I did recently. I had a home improvement. I had some new window coverings installed at home. And the installer came, had his mask on, which when I made the appointment, I confirmed all of your employees are masking, correct? And you're asking your homeowners to be masked, yes. And he came, he did the job very quickly. He was in my home for about an hour. And as he was wrapping up and leaving, and we were doing the sort of social chit-chatting thing, I said, have you been able to get access to vaccine yet? I've had mine, and it really, I felt a little loopy for a day or two, but it really wasn't a big deal. How about you? And he said, no, I haven't. I don't even know where to. My wife was just asking me about that. And I thought, how do you not know? Speaking of public messaging campaigns, how do you not know that it's available? And so I gave him my card. I said, I really encourage you to go to the county website. It's super easy, maybe even your pharmacy. And maybe he is someone who didn't want one. He didn't want to get engaged in that conversation with me. Whatever. But then 2 days later, I got a follow-up customer service call from the company asking if I was happy with the service. I said I was, and then I said, if I could, your installer shared with me after I asked him that he hadn't yet been vaccinated, and I wonder what you're doing to talk to your employees about, because they're going into people's homes, which means they're risking exposing customers, and customers are risking exposing them, and what are you doing for your workforce? And it's really quite simple. And she said, if you email me something I can print out, I'll put it up in our break room and share it with folks. And so I did that. I just sent a simple email thanking her for protecting her workforce, for helping them be part of a community public health effort, that it's so simple. Go online here, schedule your appointment. Whether anybody did it or not is what's out of my hands, but what was completely within my hands to take literally 5 minutes to ask those questions, send that email. And I think we just have to start adopting this as part of our routine. And it doesn't have to be a big splashy campaign or a big policy moment. It just has to become part of our conversation, much like since gun storage was mentioned earlier, when my kids were little and they wanted to go play at someone's house, I would say, sure thing, let me just chat with the parents for a minute to see what's going on over there. And I asked a few questions, including, do you keep guns in your home? And if so, how do you store them? We need to get there with this common sense public health measure too, where it's part of our routine daily activity to ask folks, have you been vaccinated? As Mr. Adams said, I have. It's really easy. What can I do to help you? And I think we can do that as we start thinking about it. We'll recognize that we're interfacing with more and more employers and work sites and other institutions, not always in our official capacity, but in our daily lives too. And that's really what it's going to take.
Thank you, Commissioner. Is there anyone else that would like to ask a question, pontificate, do what commissioners do? Steve, for me, I want to also thank you for, it is so clear that you are body, mind, spirit, and heart committed to this and overseeing the county's efforts. So thank you very much. And I think your words are really true in terms of focusing the anger on action, focusing the frustration on action. I think we're all so exhausted and so frustrated. And I am seeing with some of, like this weekend, I received a lot of input from very frustrated local businesses in Springfield that had apparently seen news footage of students at the U of O having parties. And meanwhile, they're convinced that they are following all, like it or not, they're following all of the governor's protocols, all of the public health protocols, and are being penalized as a result of behavior, irresponsible behavior, and they're doing their best. And I think it behooves us to understand that frustration. It's legit. I feel the same way. I really do. I mean, when I go into a food store and I see a few people that aren't masked, and I do my part, you know, I'm obnoxious, but it still frustrates me, and I'll leave the store. So, you know, I think we have to understand that even those that are doing that feel this way have legitimate reasons to feel this way, and the trick of how we redirect that into vaccination, advocates for vaccination, you know, doing what Commissioner Krieger said, wherever they are, just adding to the cacophony of get vaccinated, is legit. I mean, I want to share, because I got no less than 9 calls, and only one that was willing to use her name. So here's a woman, Shauna Haynes, graduate of the University of Oregon, owner of Jean Marie's Fabrics in Springfield, frustrated, feeling like we don't have their backs, like the county doesn't have the backs of businesses that are doing the right thing. So this really speaks to what Commissioner Farr said, and others have said, in terms of there are mixed messages out there that are conflicting. And it's so, every message that is saying, go to the movies, for example, it's time to go to the movies. It is so wrong to have greed dominate health. But that's the environment that we're in. I have a dumb question, and that is this. I'm in Portland. I need to get to a hospital really, really quick. I don't want to fly down to Eugene. I want to go up to Olympia, or I want to go up to wherever the nearest opening is. Is there some rule that the governor's criteria understands that I don't, that says if you get COVID and you need hospital care, you can only go to a hospital in Oregon?
Chair Bernie, that's a really good question. I think that I am not aware of any rule that would say that you could not seek treatment in Olympia. I think each state, of course, is managing its own hospital system, and through kind of the emergency management protocols, it's essentially each state is an island with assistance provided. Right? Yes. I would note that Washington is seeing a similar surge in cases as we are. So the phenomenon, I don't know what the capacity would be in Olympia currently. My sense is that should Oregon reach, God forbid, a moment where all of our capacity is swamped, where we would not be seeking aid beyond county, or state lines, and bringing in federal resources as well. That was the scenario I think that we were all contemplating last year at this time, of what that might look like. We don't anticipate that to be anywhere near where we are at this moment with the degree of vaccination that we've accomplished thus far. I think, I look at the story of Michigan, and which essentially, I think was us about, we're a month behind. The surge there really was, 3 to 4 weeks in time. There was a lot of similarities. We're seeing the UK variant circulating there as a driver, and we're seeing that circulating here as well. And so there's a lot of similarities to that story, but the peak was fairly rapid. The governor's OHSU modeling is suggesting that we're going to see the peak of this beginning the latter half of this week into early next, and we anticipate a decline. So I think, some of that obviously relies on folk following social health measures and the extreme risk protocols, but it also is getting yourself vaccinated. I think ultimately getting out of that box is where we are.
If for some reason we don't see a decline, will we have a series of recommendations to the governor's office based on science, based on where spread is occurring, to accommodate that? Or is that a what if that we're just not thinking about right now?
Well, Chair Bernie, as staff to you, sir, we would absolutely sit down and put forward recommendations at your request if we find ourselves, 2-3 weeks down the road and not seeing any significant improvement in the overall conditions in which we find ourselves.
Thank you. And Steve Mokraheisi, well, we co-signed a letter with several chambers. Have we ever gotten a response to that?
Chair Bernie, commissioners, not from the governor that I'm aware of. I will say that I think I was just communicating with Austin Ramirez, our economic and community development manager, who, was reminding me that we've heard a lot of positive comments and voices of appreciation from our local businesses as a result of that letter. The letter related to advocating for more vaccine and
it had 4 requests, right?
It had 4 requests, exactly. And I just wanted to say that yes, as everyone has offered today, there is absolutely a lot of frustration in the community. But what we have heard from and I would share this as well with a number of businesses throughout Lane County that I've heard directly from, who've been very appreciative of kind of the balance. I think what our business community feels like, and a lot of folks feel like, it has been a balanced approach from the board, that you're balancing the role as the public health authorities. So we have to manage this pandemic, and yes, we have to advance and support responsible behaviors, make sure people are getting vaccinated. And Mr. Adams is absolutely right. The name of the game is vaccination. That's the solution. So we need to compel people to do that. But I think our business community that we've heard directly from is very appreciative that the board is also acknowledging the challenges that the business community has faced and trying to do what it can to balance those 2 roles of public health and economic support.
Thank you, Steve. I see a couple of hands. Commissioner Buck.
Thank you, Chair. I just want to add to this conversation. As a small business owner for 15 years, I can empathize deeply with all the businesses that are doing everything that they can to abide by all the COVID protocols while still trying to make a living and employ their people. And the vast majority I see are doing everything like that. And we are advocating for them through our letters that we signed on to last week. One thing that makes it incredibly challenging for us to keep up that advocacy is when there's other businesses also being that we haven't necessarily noted that we're also on the front page of the register that are flaunting the fact that they're just not going to abide by any of these rules. And it just makes it incredibly challenging for us when we're trying to advocate for the vast majority of businesses are doing everything right. And so it's important that we hold everybody accountable. If we're going to do it, we got to do it collectively and together. And that means businesses holding other businesses accountable. That means us holding people accountable so that we can move through this as fast as humanly possible. it's a challenge because it can be horribly contentious. But we have to have those serious conversations. Without it, we are just not going to get to the point where we have the majority of the folks vaccinated and everybody can open up safely.
Thank you very much, Commissioner. Commissioner Trieger.
Thank you, Chair. Commissioner Buck really raised exactly what I wanted to bring up, a variation on it. But what I'll preface by saying is we also need to be cautious when we say the business community, because business is not a monolith, the business community is not a monolith, and different kinds of businesses, right? Restaurants are different from retail establishments, particularly when it comes to what they can do to stay safe. You can't require somebody keeps a mask on the entire time they're within the walls of your business if you're a restaurant, right? For example. So I think, again, there's the challenge of having both broad-based approaches, but also getting granular about the specific impacts, and recognizing that these different risk categories affect not just businesses, and within businesses, not just restaurants or gyms. I ran into one of our judges the other day last week as we went into extreme risk, and we talked about the impact this is having just as she had finally gotten everything in place to be able to have jury trials again, how that has to be shut down. So this is impacting every level of our community when we move in and out of these higher and extreme risk categories. And so I worry about too much of a focus on a particular sector rather than that broad impact. But I could not agree more with what Commissioner Buck said, which is that we have outliers who are both to the extreme flaunting any guideline whatsoever, and refusing to acknowledge that there's any responsibility that they have for community health and safety. And then we have some organizations, restaurants, businesses, entities that are absolutely doing their part and completely have adjusted their model of operation and are until we're in the clear rather than dealing with the fluctuations. But the vast majority live somewhere in the middle. And so in the coming weeks, I would really appreciate hearing, whether it's from Mr. Adams or others in our public health staff, about what we can do at the local level to enhance and backfill in a more locally contextual way, the statewide restrictions and measures and recommendations. Because while we have to comply with whatever state policies are in place, we do also have an opportunity to do additional complementary localized policy. And so I will, and that will just set us up for the future. Again, we're still a long way off before this is completely in the rearview mirror, for what it looks like to have local measures and controls to keep everyone safe as eventually someday the state mandates are lifted.
Thank you, Commissioner. Is there anyone else? Commissioner Farr, anything else on this topic? No. I'd like to end this with perhaps some words of hope that aren't inconsistent with what's been said. I believe that groups, local groups such as chambers of commerce, not chambers of business, but chambers of commerce, whose membership typically gets broken into different sectors, to have demonstrated a concern, as Commissioner Buck mentioned, for those businesses, and all the chambers are advocating the COVID health protocols, and they have programs that to develop relationships with them and others in the community is the first step to deal with where we are, which is an historical different place in the evolution of managing this. We are now moving from this huge demand, right, to how do we reach out and achieve vaccination and achieve herd immunity, which means going into different nooks and different crannies and different areas and changing minds. And I think the stronger our alliances with existing organizations that will get into some of the myopic aspects of different types of businesses or work environments or home environments or concrete living, different kinds of things. I think that having those allies to extend our reach under the guidance of, I think, a very enlightened county public health staff, is going to propel us forward in exactly the ways that the last two commissioners have articulated in their comments. So I think we're in a good place. I think we have to be strategic. Speaking for myself, I'm glad that letter was written. I'm glad and signed. I'm glad the business community knows that we're with them, not against them, and that we're going to work together and get back to normal. So thank you, Steve. See you next week for more fun.
Thank you, Chair Bernie.
I know that we are a little behind, so I am going to focus us on the agenda. It is now item 6, consent calendar. Does anyone wish to make a motion on consent calendar? Vice Chair Farr.
Chair Bernie, I move the March 4th consent calendar.
Thank you, Commissioners. Is there a second?
I'll second with the friendly amendment that it's May 4th. I thought
Did I say March?
March.
Thank you. In fact, May 4th.
That's pretty good, Commissioner Trieger. I didn't even catch that. Okay. The consent motion to approve the consent calendar has been made by Commissioner Farr, seconded by Commissioner Trieger. Is there discussion to the motion? Seeing none, all those in favor, please signify by saying aye.
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 Opposed, same sign. Let the record show that the consent calendar for not March, but May 4th, 2021, moved by Commissioner Farr, seconded by Commissioner Trieger, is passed 4 votes to 0. Commissioner Bozovich excused. Item 7, County Council. A, announcements. Mr. Dingle.
Mr. Dingle had to attend a different meeting today, so he is not present for this meeting, and the next item will be handled by Becky Taylor.
I was wondering why this image of Ms. Taylor appeared on the screen, and there you go. Hey, Becky, how are you?
Good morning, Chair Bernie and Commissioners. I'm Becky Taylor. I'm a Senior Transportation Planner in Public Works, and I lead Lane County's Transportation Safety Action Plan implementation. I'm happy to be here today on behalf of Steve Dingle, who leads the Fatal Crash Investigation Team. And this item was introduced to the board as part of that team report on March 16th. The item before you is a board order to implement a safety initiative of that team. The board order is to establish a safety corridor on the first 7 miles of London Road, which is in Commissioner Buck's district. Thank you, Commissioner Buck, for submitting a letter of support for this pilot project. This is a 2-year pilot project that would commence on the 4th of July holiday. And this program was created by the 2019 Oregon legislature to test the safety corridor designation on county roads. Previously, this designation was only available to state highways, and it's been proven to be effective in reducing fatal and severe injury crashes. The pilot project brings together engineering, education, enforcement, and emergency response, and this corridor was selected following an equity analysis. The designation involves doubling traffic violation fines. Signs will be installed that say safety corridor and fees double. The Sheriff's Office has committed to working overtime with reimbursement grants from the state to provide enforcement on the corridor. Public Works has secured federal safety grant funding to install engineering roadway departure countermeasures, such as curve warning signs on London Road this summer. And we're developing a public education campaign to reduce DUIs, driving under the influence of intoxicants, which includes alcohol and all drugs. And it was great timing for me to hear Dr. Jess Seifert's presentation to you earlier this morning about a cannabis inclusive DUI campaign. We have and we will continue to consult her about DUI campaigns on London Road. This corridor is being managed by an advisory committee, which includes the Fatal Crash Investigation Team, Oregon Department of Transportation, South Lane Fire and Rescue. And Emily Buffbear of Public Health was elected chair of that committee, and she's leading the public education campaign. To follow up on Commissioner Trieger's question of Dr. Seifert earlier this morning regarding Lane County's ranking with other Oregon counties, just with regard to fatal and severe injury crashes involving drugs and alcohol, the latest data from the state noted that Lane County was second in the state with the greatest number of fatal and severe injury crashes involving drug and alcohol, and how that number doubled from the previous year. So this is a problem, a growing problem, and a preventable one. We've intentionally timed implementation of the safety corridor with the 4th of July holiday because all of the fatal and severe injury crashes over a 5-year period on the London Road safety corridor involved drugs and alcohol, in which 3 people died and 3 people were seriously injured. Most of the fatal crashes throughout Lane County happen in the summertime. We see Cottage Grove Reservoir as a place to focus our public education messaging, to encourage people to make a plan before they recreate, to designate a driver and make safety a priority. As you've been discussing all morning, we have so many public health and safety priorities that overlap right now, and I really appreciate the common sense public health message of individual actions in our daily lives that Commissioner Trieger shared with her experience on vaccinations. Similarly, I envision that we all start asking the question of friends, family, and community members, what's your plan for getting home safely? Updates about this program will be provided as part of the quarterly reports from the Fatal Crash Investigation Team, and the board's authorization of the safety corridor designation on London Road will enable implementation of the pilot program. A proposed motion for your action today is included in the agenda packet, and unless you have any questions of me, that concludes my presentation. Thank you.
Thank you, Ms. Taylor. And I apologize. I was looking at 7A, but since we're at 7B, for the board's sake, this discussion is order 21-05-04-07 in the matter of establishing a safety corridor on London Road pursuant to section 21C of chapter 501 Oregon Laws 2019. Before I call on Commissioner Buck to make a motion, are there any people that would like to make comments or ask questions of Ms. Taylor? Commissioner Farr.
Chair Bernie, as an aside, and I state this every time I see Ms. Taylor, is that in 2018, Ms. Taylor was named the Outstanding Public Employee for Lane County. Congratulations once again.
Is there a statute of limitations on, no, I'm just kidding. Are there any other comments? Thank you, Vice Chair. Comments or questions? Seeing none, Commissioner Buck.
Thank you very much, Chair. I'll move approval of Order 21-05-04-07 as presented.
Is there a second? I actually could tell this time, Commissioner. So order 21-05-04-07 in the matter of establishing a safety corridor on London Road has been moved by Commissioner Buck, seconded by Commissioner Trieger. Is there any discussion to the motion? Commissioner Buck.
Thank you, Chair. I just want to briefly thank Becky for all your work on this particular item. The citizens of Cottage Grove know that this corridor is notorious for injuries and deaths, and I think it will make a significant difference. My interest really is the long-term difference that it could make, because this won't last forever. And we know how people abide by some laws while they're being enforced, and when they're not, they can easily go back to their regular mode of transportation. So what I'm hoping to see at the end of this is the research that's garnered from it and how we can actually improve things on the long term, not only in this corridor, but in other areas around rural Lane County as well that have the same issues and share the same concerns with their citizens.
Thank you. This is a very famous corridor from my wife, who taught at Cottage Grove High School for 30 years. And I certainly hope that the ideals and intent behind what Commissioner Buck stated can in fact occur. Fingers crossed. Is there any other discussion or comment or question? Vice Chair Farr.
Ever so briefly, just to point out that as we tighten laws and make laws more applicable in specific to particular areas, like a safety corridor, it does place additional responsibility and requirements on the sheriff's department to enforce the traffic laws that we put into place. And we all know how stretched thin the sheriff's department is, particularly in rural areas, remote from the central urban core. Thanks.
Thank you, Commissioner. I've observed that Ms. Taylor agrees with most comments made by her head going up and shaking up and down. Are there any other questions or comments from Ms. Taylor? Hearing none, all those in favor of the motion made by Commissioner Buck, seconded by Commissioner Trieger, to approve Order 21-05-04-07, please signify by saying aye. Aye. Opposed, same sign. Let the record show that this motion is approved 4-0 with Commissioner Bozovich excused. Thank you very much, Ms. Taylor.
Thank you.
Okay. We have, Diana, I believe we have no executive session this morning. Is that correct? Oops, I'm sorry. County Admin. Steve, please, announcements.
I'll be very quick, just an elections update for you. Over 272,000 ballots have been mailed to active registered voters. Most ballots should have been received in the mail by today. Registered voters can check the status of their ballot at oregonvotes.gov. Driver teams begin picking up voted ballots for our 20 Dropbox site locations today. Number of received ballots will be updated on our webpage by the end of today, Tuesday, and again on Friday this week. Again, the website is lanecountyor.gov/elections. A reminder to voters to review both sides of their ballot, as some ballots have additional voting opportunities on the back of the ballot. Once a ballot has been returned, it cannot be amended or recast. So make sure to check both sides of your ballot. Staff, Lane County election staff are available by phone to assist voters with registration or voting questions at 541-682-4234 from 9 a.m. to noon and 1 p.m. to 4 p.m. daily. And again, check for more information on our website, lanecountyor.gov/elections. That's it.
Thank you very much. And we also have item 8, County Admin B, Order 21-05-04-08, in the matter of creating a new special revenue fund commencing fiscal year 2021 for American Rescue Plan Fund. And Christine Moody, would you please walk us through this item?
Yes, thank you, Chair Bernie, Commissioners. As part of the American Rescue Plan, the commissioners are aware that there's a direct allocation to counties. There was about $65 billion allocated to counties. Of that amount, Lane County expects to receive $74 million in 2 payments, the first being received within 60 days of the signing of the act, which happened in mid-March. So we are bringing to you today to create a special revenue fund that will allow us to separately track these funds because they do have specific allowable uses. And so we're wanting to do that before the funds are received. And this will just create the fund. Any budget that will be put into the fund will be coming back to you through those other normal budget adoptions. So I'm open for any questions.
Thank you very much. Does anyone have any questions of Ms. Moody? Christina, as I understand it, I don't see any hands. Are there any hands? I'm sorry. You can see me like looking at my screen as close as I can. As I understand it, this is simply creating a fund to account for, create a mechanism to account for dollars received from the American Rescue Plan. Is that correct? It's not new dollar, not, okay.
Correct, yes.
Thank you. Steve, were you gonna add to that?
Yeah, thanks, Chair. And just to add a little bit of context, that's absolutely right. This is just to create the fund. As Christine said, any request for allocation or expenditure of the fund would come back to the board in a separate action. Our plan, I think, as I've shared with commissioners, Our staff has been meeting, leadership in our organization has been meeting, talking about developing guiding principles, policies and priorities that we'll bring back to the board for you to consider. Our goal is by late May to do that. We're still waiting on guidance from U.S. Treasury on how funds can be used. Important to note, as we always do, these are one-time funds that need to be invested in one-time expenses. That it's not an ongoing revenue source. We would add a program or ongoing staffing or pay for an ongoing expense, but really for one-time replacement of revenue in those and new expenses related to COVID. So we'll have more to talk about later as it relates to potential expenditure of funds. We obviously want the board to be deeply involved in that conversation. This is, again, just the establishment of the fund that will house these resources.
Questions? Yes, Commissioner Farr.
For a motion, if you're ready, Chair Bernie.
Certainly.
I'd move Order 21-504-08 in the matter of creating a new special revenue fund commencing fiscal year 2021 for American Rescue Plan Fund.
Thank you very much. Order 21-05-04-08 in the matter of creating a new special revenue fund commencing fiscal year 2021 for American Rescue Plan Fund has been moved by Vice Chair Farr, seconded by Commissioner Buck. Is there discussion to the motion? Yes, Commissioner Trieger.
Thank you, Chair. Just a quick question. I just realized it says commencing fiscal year 2021. Is there any limit to how long that fund will be in place? Will it now exist forever even when funds are expended? Just curious how that works.
So we will get rid of the fund when it's no longer needed. Yeah, right now the allocation of funds can be spent through December 31st of 2024. So it will be there for at least a few years. So but we will disband the fund, yes.
Yeah, so this puts it in place, it commences now and is in place for the duration of the availability of the funds.
Correct, yes.
Thank you.
Yes, so we will either get rid of it, disband it when the duration is over. Thank you, Commissioner Trieger. Are there any other? My understanding, Christine, is that this is none too soon. Is the county not expecting its first payment in about a week?
Right, could be any time in the next couple of weeks because it did say the 60 days from March 11th is what we're saying. Yes.
Are we at about day 52 now?
We're close.
Yeah, okay. If there are no further questions, a vote on the motion made by Vice Chair Farr, seconded by Commissioner Buck. All those in favor, please signify by saying aye.
Aye.
Aye. Aye.
Opposed, same sign. Let the record show that Order 21-05-04-08 is approved by this body, 4 votes to 0. Commissioner Bozovich excused. We have no executive session scheduled for this morning. Is there other business from any commissioner? Oh, I'm sorry. Yes, Commissioner Trieger.
Thank you, Chair. Just briefly, appreciate the update on elections. I am about to walk my ballot to the box across the street. Remember to sign the back of your envelope. And after I do that, I'm going to walk over to the farmers market because it's the first Tuesday in May, which means the Tuesday farmers market's open again. And I just want to welcome back all our local producers and growers and say how exciting it is to have that back in downtown for the season, and appreciate that sector. We were talking earlier about businesses and all the precautions and care they've taken to keep bringing us all the wonderful local products. So welcome back Lane County Farmers Market to the Tuesday downtown market.
Thank you. Is there any other business? Well, we have a long day ahead of us. So at this time, we will recess our meeting until 1:30 this afternoon, at which time we will resume. We will deal with the 3rd reading and public hearing on the quarry. And we then will have a budget committee meeting this evening. So enjoy your lunch. See you at 1:30. Thank you.